Thank you for everybody for coming today to our presentation on the Master Plan on Aging for Older Adults in Pennsylvania. My name is J.R. Reed. I'm the Executive Director of Lehigh County Office of Aging and Adult Services, and so I cover Lehigh County, but what we're going to present about today is a master plan of something that's going on across the whole Commonwealth of Pennsylvania, and we'll get into that in my slide presentation here as we begin to talk about that. So it's really important that all of us that have come today, you've been given a card here. This is a comment card that I'm going to go through at some point, and we would ask that you would put your comments down on this card so that we can send this back to Harrisburg to take that information down, because they want to take your input and my input and everybody in the community's input on developing a plan for us as we have our older adults aging in Pennsylvania. So at the top of this form, it asks for a name, it asks for an email address in your county. If you're not comfortable with your name or your email address, that's all right, but please put whatever county you're on from there. And it doesn't matter if you're from another county as well. If you're from Berks County, Northampton County, Bucks County, whatever county, it does not matter, because these are the presentations are going on, the same ones across the entire Commonwealth. So thank you very much for being here. So let's go ahead and let's get started with the Master Plan on Aging. There's an executive order by Governor Shapiro that was signed into date on May 25th, 2023, and the idea of the executive order was to give Pennsylvania Department of Aging, which is the state unit on aging, the go-ahead to start to do a study on what we're going to do for the next 10 years for aging adults in Pennsylvania. So right now in Pennsylvania, 1 out of 4 Pennsylvanians are 60 and over. And by 2030, 1 out of 3, 33% of our population. So you can see the growth that is happening. And what defines 60 and over? So there's an act called the Older Americans Act that was written in 1965 that defines older adults as 60 and over, and it defines a lot of the things that the Area Agency on Aging does, which that's what my office is, the Area Agency on Aging. And so we want to look and conduct this study to see what we need to do, because our population is growing. It's getting bigger, it's getting larger, and we need to do something about it. So that's why Governor Shapiro put this master plan in order. It's a multi-sector, multi-level plan that we need to collect that kind of information and data, and they're going to begin to write that this entire year. They're hoping to have it completed by February of 2024 so that they can use it for the next continuous budget cycles. The other thing to let everybody know is I was at a conference probably about a month and a half ago. It was a national conference. There are 3 states that have already done this. California, Colorado, and New Hampshire has already gone through this process. And one of the things that they've said and done in their process is they've taken all this information down, and then they've gone and they've taken and funded infrastructure for older adults and people with disabilities that need those kinds of services as they've done that plan and gone forward with it. So it's a really important thing. There's about another, I think, 20 states, Pennsylvania being one of them, that are in the process of doing it or are planning on doing it in the near future. So it is a really important plan that I think will help us get this kind of services, the kind of things that we need in our community. So that's why it's so important that we go ahead and do that. So, you know, you guys are what are called stakeholders here. So that's why we asked all of you guys to come in and to respond on this. You know, it doesn't matter if you're not 60 either, maybe you're a caregiver, but all of us know somebody that is 60 and over and somebody that might need help. And so that's why it's so important for us all to fill this out, give our comments, and do that. And we're also going to take public comments here later on as we go through this whole presentation. You can go ahead to the next slide, Gus. So the process. County and local government representatives, members of the General Assembly and their staff, federal partners, and members of the executive branch of state government are engaged in trying to collect information, collect stuff from professionals, collect stuff from stakeholders, collect things from people that need to give us the kind of feedback that we need for this. Next slide. After the publication monitoring, the master plan, like I said before, is going to be on February 1st, 2024 is when they plan to have it out and written and put all the comments in it and a bunch of other information that they're going to have. The published master plan will be identified for quick wins. What kind of aspirational goals can there be? What kind of things can we do to help people? What kind of things can we change the system? So there's going to be quick, low-hanging fruit kind of things, and then there's going to be plans on what they're going to do. The master plan is not going to sit on a shelf and collect dust. Oftentimes, you'll see with government, I know over the past, and I know I work for government, I work for county government, but we see plans happen and they sit and collect dust. This is going to be a plan that is not put on a shelf. It's going to be actively used. It's going to be reflected upon. It's going to be updated as we go. It's going to be very transparent. They're planning on putting a public-facing portal so people can see where they're at with stuff, see what kind of information, see how they can continue to adjust to the information and how we're going to go with dealing with the older adults as we have over the next 10 years. The next slide. The next slide is the feedback is going to be off of AARP's domains of age-friendly communities. So there's 8 domains here. I'm sure you guys can't see that because it's too small probably for you to see. But when we are filling out our comment card, they are around these 8 domains. Don't let them get you off because it doesn't matter what your comments are. If they don't even fit into the 8 domains, we still want your comments because there might be things that are outside of those domains or don't easily fit into one of them, but they're designing it off of AARP's age-friendly communities. So with the age-friendly communities, there's 8 domains. Several of them are like outdoor spaces and buildings. Where do you guys live at? How do you have access? Are there people for disabilities that have access to the malls? Are there curb cuts? Are there things for people to easily get into the doctor? Are there, are there parks? Are there activities that are easily accessible for people, older adults to get to? Transportation. Seniors can get out and about using a range of affordable, user-friendly transport associated with services. So that's another area that we know we need feedback on, and that's a really important thing. I know somebody over here just had mentioned something that they wanted with transportation to me earlier. Housing. Seniors need affordable options, accessible, safe options, and not just for low income. We also need options for everybody, every level of income, all income levels, all minority statuses, all different kinds of statuses in the community. We need to have feedback on that and have those kinds of housing situations. Social participation. Seniors are supported to be active in the community and doing things that they enjoy. It's so important. We found this out during the pandemic that if we don't have people socially active and they're isolated, it causes all kinds of mental health issues. It causes problems with their health, all kinds of different things like that. It's so important that we are engaged socially with one another because that's how we are made up as human beings. Respect and social inclusion. Is everybody included? Does everybody feel welcome? Do people feel welcomed in the building? Do people feel welcomed in the community from all aspects of life? Civic participation in employment. Seniors can participate in employment, training, lifelong learning, volunteering opportunities, inform government policies. Communication and information. This is a really important one. What kind of communication is out there? How do we get the message out to everybody? How does everybody hear about things for older adults? How do we know that this activity is happening? Or how do you get this service? Or how do you access things that are necessary for you? Community support and health services. Health services are very vital. As we age, unfortunately, we get a portion of our population that gets more disabled. How do we access those health services? With Medicare and supplemental insurances, are the doctors available? Do they have the types of services that go out to people's homes when they need services in their home as opposed to being able to get out of their house? Those kinds of things are really important. What kind of community supports are out there? So you can go ahead to the next slide. So, key features include pleasant, secure, and physically accessible outdoor spaces, well-designed, affordable, secure housing, affordable, accessible public transport, secure neighborhoods, respectful relationships, support and health community services, opportunity for socially active, opportunities to participate in suitable volunteer, civic, and employment positions, and information that is easy to access and understand. So now, we're going to get to, as I mentioned, our comment card here. Okay, so you have your comment card here. What we're going to do is we're going to go through At the top, underneath the name, it talks about the different domains there. We're going to be a little bit out of order from what it's on there, but as you're filling your comment card out, if you feel like it meets one of those domains or multiple ones of those, check the boxes. But the most important thing is comments start at the bottom and go on the back. And we would like your comments down on there. Now, I'm also going to go through each of these domains and ask for public comments. So we have a microphone over here that we're going to run around. If you need to make a comment, please let us know what your comment is, but wait till the microphone comes to you because not everybody in the room can see you. And the other thing to let you guys know, I forgot this at the beginning, and I'm sorry, but we are recording this session today. We will have this on our website as well. And there's other ways for individuals maybe that aren't here to access this information too online. The Pennsylvania Department of Aging has a space on its website to send in comments that way, or if you have people that want to take these two and send them to our office or send them to Harrisburg, you can do that as well. So there are multiple ways to do that. So, all right, so we're going to start with the first one here. We're going to go to transportation because that's really an important one that kind of crosses over some of these domains. Transportation includes the full range of ways people get around, from walking to personal vehicles to purchase private or public services. How easy is it for you to get around the community? Can someone without a car get to places they need to go? Do you feel safe walking, crossing corners, or cycling on the streets? Now, the other thing I'm going to say to everybody is we're in a building here that's a county building that we rent out to individuals. We're not looking for just comments on the building here. This is way outside of the building. What happens outside of this building? Now, if you do have comments about the building, I'm more than glad to listen to those as well, but this is more like if you're living in the community. What's the transportation like? Or what's the transportation for you guys in and out of the building here? So I just want you guys to realize this. The focus isn't on the building here. Not saying we won't take some of that, but it's more than the building here, okay? So transportation. What does anybody think about our transportation services that we have in Lehigh Valley or Lehigh County at this point? Do people feel like they can get around? Can you get to the doctor easily? Anybody want to make any comments about that? They got hands up here.
My comment on the transportation would be you have Metro Plus or whatever they call it these days, because I used to work for the service. And I know people, I have a handicapped cousin that's in a wheelchair, and she makes an appointment. She's supposed to be picked up at 9:30. A lot of times, she's not picked up till 10:30, so she's getting late for her appointments. And I'm not only specifically talking about her, but everybody else, people in here also. And then for return, they're going past your house because they have a schedule, but it doesn't make sense. People are waiting an hour or two or longer.
So you're talking about Lanta, the shared ride program that you can
Yes.
schedule and get on. And just
Yes.
for everybody to know, as she's finishing her comments, as Kim goes on to the next one, Lanta gets funding from the lottery. The lottery in Pennsylvania helps senior citizens 60 and over. And Lanta, for anybody 65 and over, gets funding to provide 85% of their shared ride to doctors, to the hair, to the grocery store or wherever, and then you're required to do 15%. That goes directly to Department of Transportation at Pennsylvania level.
My name is Judy, and I work at an independently owned family practice. We have a large elderly population, multicultural in Northampton County, but our patients come from everywhere around here. And the transportation comment I have is, I think, in addition to the services that she just mentioned, that if the plan could address how someone could obtain a reasonably priced insurance so that seniors aren't sitting on the service for too long. I mean, if they're on a 2-hour ride and then they're 2 hours in the doctor and then they're 3 hours waiting to get home and they're already, compromised with multiple health conditions, it's really difficult. We appreciate the services that you do have in place and want you to continue the metros and the Palmerian Easton and all of that, but people, and an Uber really isn't reasonable for someone. Family caregivers get worried putting someone in an Uber. You need people who have training in dealing with someone, and private vehicles that they can use to transport the wheelchairs, but I think if you work with the insurance department as well to try to get us affordable individual policies, it would really help the valley.
Okay, that's great. So work with the insurances and come up with other alternatives for transportation. Anybody? What's that?
I meant auto
Auto insurance, okay. Auto insurance, she's saying.
Yeah. My name is Sharon, and I just want to say that it's also very important on the people that are being picked up for them to be on time. Because sometimes I can look out my window and I see the van sitting there and the people aren't there. So I think it's not only on the part of receiving, it's the part of when you go. If you get up 15 minutes earlier and get down there, that's all it takes.
Okay. Fair comment. Right behind you.
Hi, relative to that, when transportation is given, I understand that there are some insurance companies that will pay for this. However, my experience has been that the vendor who's supplying the transportation comes from some distance away from the community. So that's really inconvenient as well, because a lot can happen a great distance. So it's got to be something that's more local than a big distance.
Okay. Back in the back.
Hi, can you hear me? Yes. You're talking about auto insurance and everything, and maybe in some way there can be some kind of a package, but is there not a better way to help those of us who have to take driver tests to not have to go through that nightmare where everybody has to look into these antiquated equipment and be expected to see? Is there some way that seniors can have some kind of automobile program so that we have the ability to continue to drive? I have been told by more than one ophthalmologist that that equipment is so antiquated that they don't expect seniors to be able to see. Thank you.
Okay, really good comment. I don't think I've heard that in all our listening sessions yet. That's a really good one. All right, the next one's respect and social inclusion. So this may mean access to an environment that encourages respect in treatment and interactions, intergenerational activities, and involvement by residents of all ages, abilities, and incomes. Does your community encourage respect for all persons regardless of age, ability, and income? Are there opportunities to interact with people that are different from you? So does anybody have any comments on that? So this would be stuff like, civic participation, voting, participating in elections, involvement with residents of all ages, abilities, and incomes, intergenerational activities and interactions, how important that is, and that we're included and we feel like we're part of the community that we're at, where we're living at. Does anybody have any comments about what we need to do? What kind of things would make things better from the way they are? Any thoughts? I mean, what do you guys think about, oftentimes I think it's important that seniors or people that are older are engaged in the community. You guys have so much to give, so much history, so much experience that the younger generations need to have and that we need in our communities. There's a lady back here.
Hi, my granddaughter goes to Whitehall High School, and the cheerleaders and the football players just went to Fellowship Manor and had a spirit night over there and interacted with all the residents. It was very successful, and then they in turn invited the cheerleaders and the football players to a bingo night.
I love that. That is great. Great ideas. Would it be good at senior centers like this? We have a senior center here. Should we be doing stuff like trying to, like with the schools? Are there things that we should try to be reaching out to the schools and trying to do more activities like that? Are there other ideas that people might have? You know, should schools be contacting coming to buildings like this? You know, what kind of things can we do, I think, to make things better so that we're more included and we're socially engaged and we're including everybody and making people feel comfortable and included, and we're dealing with the generations?
One suggestion I have would be, you know, some people have never been comfortable in big social settings their entire life. You know, they worked, they went to their church, whatever, but they're not comfortable in big social settings. And they still need some visiting or some, so I know it's impossible to think we can afford to have home visitors, but maybe some kind of telehome visitor, just for social interaction, not for medical needs, not for insurance needs or financial needs.
Good, yeah, that's a good point. And then, like, I think that it goes along to what kind of funding do we need for that kind of thing. But that's important because I think we found that through the pandemic that people, if they're isolated, it's a problem. It's a huge, huge problem. So, like, should we have funding to do that kind of stuff? Can we develop more volunteer programs to do some of that kind of stuff?
Speaking of activity with younger people, I think a perfect example is what we do for Halloween. When the kids come in here trick-or-treating and the adults enjoy that. There could be Christmas caroling, there could be all kinds of activities. It shouldn't end up costing a lot of money, but I so look forward to trick-or-treat. It was my first time, and I was just so impressed with what went on, and the kids loved it, and the people I saw loved it, so food for thought. Okay, thank you.
Yep. And then up here.
I can remember the candy stripers in the hospitals and what help they were with the elderly and the young and just everybody. I don't understand whatever happened with that because I don't think it should have ever went away. Because they were volunteers and they were helping to go to different rooms, and now the hospitals and stuff say they're shorthanded. Well, if you had these teenagers back, they would help. It would be a big help, and it might even encourage them to go into the health program.
That's a good point. We need people in the health programs. We need providers. We need kids that want to go to school and do that. I think that's a great thing. What's the volunteering like for that?
I think we have the perfect opportunity right here. We have Cedarbrook next door. A lot of our people are there. A lot of these people don't go up and just say hi. You should see when we go up on our scooters on the highway, no matter how it is, they light up. Even the people we don't know, they love seeing. I mean, of course, I'm not rap type, but they love seeing us. They love seeing us. There's about 3 of us that go up together, and they enjoy it. So why can't a lot more people go?
Yeah, I think we need to volunteer and put our time out. I think there's a lady back there. Yeah, I love that. People don't get visitors in facilities like that.
Okay.
Yep, go ahead. You're up.
Something we did here, it was late in the season, was have the young kids come in, and the older adults that live here were supposed to interact playing different games and stuff in the morning. Well, I brought my great-granddaughter in, and she was 10 years old, and somebody else had a 10-year-old, and they had a blast. We never laughed so much and they did too. And I thought it was really a great idea to intermingle the children in with the elderly.
Good. Okay. Perfect. I love it. Did you want to talk? Yeah. Later right here. Hold it up to your chin when you get it. Make sure it's up at your chin.
A few years ago, we had student nurses coming every week. They came for about 6 weeks. They socialized with us, they took our blood pressure, they checked our hearts, and it was very enjoyable. They They were very happy to be here, and we were happy to have them.
Great, that's great. I love hearing that. Student nurses coming in and doing stuff. Okay, well, let's move on to the next one, which is communication. So, timely, clear information is important for many tasks, such as accessing community services or obtaining health care. What sources do you go to for getting that information you need? What about during emergencies? Is this information easy to access or easy to understand? No, it isn't, huh? So people use social media to connect with other people as well as learn about the news, events, activities, or advice. What do you guys think about communication? I think that's so important. I know our office, I have several people from my office here as well that a lot of times people call our office in crisis, meaning like a daughter might be visiting at Christmas time. They come home, they see their mother. Their mother's not doing as well as they'd seen them in the past. So then they go back home and they call us because they're in crisis. What do I do for mom? Or mom might have a medical emergency. So what am I going to do with her? How am I going to get help for her? How am I going to do that? And they don't know how to navigate the system. Now our office, the Office of Aging or the Area Agency on Aging has that information, but not everybody knows about us. How do we get communication out there better? How do we do a better job with this? Go ahead.
I'm a caregiver for both my mom and my mother-in-law, and the information out there, first of all, they can't afford a newspaper. So I know one of the representatives is having a senior expo coming up. Well, neither one of them would know about that. It was in the newspaper, but they don't get the newspaper. Neither one of them are computer literate. Neither one of them are on social media. So we need to come up with another way, because there are a lot of seniors who don't have tablets or iPhones and don't know how to operate the stuff if they do have it. So we need another way, maybe a newsletter that goes out once every 3 months or something like that in the mail. Because of course they still get mail, but they just don't have the technology that other people do.
Those are good points. We got to have a better way to getting communication out multi-level ways. So, the other thing is when somebody's in crisis, there's different ways to get services. Insurance, Medicare pays for a period of time. What do you do when Medicare is done? Then there's Office of Aging services. There's services through other means. So like, how do we navigate all that? Because it's so confusing to everybody. Anybody have any other comments, thoughts?
My mother and father both received from the Bureau of Aging. They were both taken care of very well and everything, but I don't think enough people know what's all out there. I worked for Cedarbrook for many years. I was a 40-year nurse's aide. And people will come up to me and they'll say, well, how do you know where to get help? And I always say to them, call the Bureau of Aging, because that's the way you have to. Like she said about computers. I have a computer, but I don't do anything like that on the computer because I'm afraid I'll goof up or somebody will get information that they're not supposed to have.
Yeah.
That's a very dangerous thing.
It's true. It's true. I think you had a hand in the back then. But, coordinated services, because like things come from different areas. Should everything come from one? Should it all go through Pennsylvania Department of Aging? Pennsylvania Department of Aging was created, I'll get into that later after the next comment, but, should it go through one entity? Would it be better that way? Go ahead with your comment, though.
Regardless of services, I was just recently asked, is there any legal help available for people? And I was just thinking, I was at a product fair yesterday at our church, and I was thinking that's always periodically a great way to get information out, have some kind of a product fair where everybody here could come and see and talk to people and get help they need.
It's good. It's good. We do have legal services. We have a vendor, North Penn Legal, that people can go to for legal services. They have different ways to get funding, but you didn't know that, but that's an important thing for older adults to know as well. We have another comment here. Uh-oh, Pat's up again.
Recently, I had to move apartments because it was getting more dangerous. So I went to the Department of Aging to get help for cleaning and wash. I have too much money. I have too much money because the government gave me 2 stimulus checks. So why do I have to, and I couldn't get help, so now I'm paying my own helper to do laundry and cleaning. So the Department of Aging, in my opinion, stinks.
Do they? Uh-oh. So what you're saying is we need more funding to the Department of Aging to do more programming for older adults. Or they need to up the income levels? Because you might just be above the income level, but you still need help. And that's what you're kind of saying, right? The other thing I was going to say about the Pennsylvania Department of Aging, in the 1970s, I think it was 1978, there was a lot of advocacy that went in from seniors to advocate, because they were under Department of Public Welfare at that time, which is Department of Human Services now, feeling like they were left out because they were in with huge programs like Office of Developmental Disabilities, with Office of Mental Health, with Children and Youth Services. So they advocated that in 1978 they created a Department of Aging, and the Secretary of Aging is a cabinet level position with the governor, so that it stayed that way. And so my point was, should stuff go through the Department of Aging for communication so that they can say everything for senior citizens instead of sending stuff to PennDOT or here or there or other places, because it seems like sometimes there's breakdowns in the system. So that's just a thought that I had out there. Again, remember, you guys have your comment sheets, so you can write comments down yourself on this stuff. Anybody have any other comments before we move on to the next domain? Good comments so far. Yes, ma'am.
I have a question. Why?
Can you microphone, please?
Why has the Department of Aging not been at this all along? I know you said funding is part of it, but for me to find information is very difficult. And I'm hearing you have legal services, you have access to insurance, and the suggestion that you raise the income level is definitely, if you go back and look at the rate of inflation, and of course we all got a boost with Social Security this year, and that put some people over the top, that they could not access your services. So you need to reevaluate that. I agree.
Okay. Fair questions. What's that? Put that stuff down on the paper. It needs to go right down on the paper. People need to hear that. That's why we're getting your information, because they really feel like people are listening now. So we need to all put that kind of stuff down if we feel that way. All right, let's move on to the next domain, unless anybody has any other comments. I think the next one's housing. Now, you guys are an amazing housing building here, right? But not everybody has this building. Not everybody outside of here has this. So think about, before you were in here, think about your friends, your family, other people outside of here. What do you guys think we need to do with housing? So housing, as it reads in the slide here, this refers to living spaces that are safe, affordable, provide essential services when properly maintained. As people's health changes, their needs for housing may also change. Some people may need to consider moving to a new home or a different community. How difficult is it to find housing in your community? What specific challenges, if any, do older people or people with disabilities face in finding appropriate housing? How difficult is it for somebody to modify their housing to improve accessibility or safety? Due to your health, do you think you might want to move to a different home or community at some point? I hear nope. Before I was ever an executive director years and years ago, I went into people's houses. I'm going to tell you, if you go into people's homes and you talk to them about, do you want to leave your home or go to a facility or move out of your home, 9 out of 10 or greater are going to say, I want to age in my home if I possibly can. I think that's a really important thing to start with. So I got a hand back here.
This was really my main reason for coming here today. This kind of ties into housing and the healthcare need. I'm very familiar with the Home and Community-Based Waiver Program, and as an independent family practice physician office, we get many patients and their family caregivers bringing us those forms, and there seems to have been an influx of them recently from the independent enrollment broker, and sometimes our patients need to be deemed NCFE, right? Nurse-
NFC, nursing facility
NFC,
clinically
right.
eligible.
And sometimes they do not need that. And we have family caregivers who get extremely upset with us, with the front desk staff, with myself, with the physicians, and verbalize, angrily that we're not signing off that they need it, because they, as family caregivers, want to be paid to be in the home. And there is a benefit to keeping people in the home, and we want them in their home if that's where they want to be. But we can't commit fraud by
Correct.
incorrectly filling out the
Yep.
forms. So I think you need to do a better education with the physicians so that they feel more comfortable saying no when no is appropriate. And then also for the family caregivers. And the one family I'm thinking of, I know did contact the Northampton County Aging several times as well, and we were all on the same page. But sometimes people do want that and need it, and it's a great program. So I think you need to get more education out to I know in a hospital-owned practice, they have more social workers on staff, but there are still quite a few independent physician offices seeing the aging population, and we need some resources and education too.
Okay, those are great. So with services, what that is there's a waiver program that actually isn't ran by the Department of Aging or my office, but we are part of the process of getting somebody eligible. So there's a doctor's form that's eligible. There's an independent enrollment broker named Maximus that helps people navigate through. The county assistance office involved, and then the area agency on aging does a medical determination assessment on people to process. And then when they get on that program, they go to a managed care organization to manage that program. But if you're not eligible for that program, there are programs through the area agency on aging that help with that. They're called option services, but they do look at income and stuff like that. But those that just explain that to everybody. Any other thoughts on housing?
Also on the housing level, most of the time you have to wait a year and a half, sometimes 2 years to get in. And by that time, by all that waiting, you can't get in. Then you have to go into a nursing home, a lot of people.
Yeah.
So the need more buildings like this,
There you go.
need more low-income housing for people.
More
can't afford
affordable
to
housing
stay
in the
their
community.
homes anymore.
I think the other thing,
That
back to
need
the other comment,
to wait
is there a way for us to set programs up to pay people to take care of their loved ones in their home? They can do it on the waiver program, but we really don't do that on the options on the other programs. There's ways for us to do that, or to invest in people not losing their house because they're loved, and they can through what's called a state recovery. Is there a way for us to say, if you give so much caregiving, maybe they don't recover as much of the house or something like that? Any other thoughts on housing? Nope. Okay, let's move on to the next one. Social participation. Public events are activities that are open to the community for the purpose of entertainment or socializing. Social isolation and loneliness are major factors that affect health and well-being. We've talked about that. What do you think communities can do to make different activities more accessible to older people and people with disabilities? What are the main barriers older people and people with disabilities face in participating in community events?
I do want to thank you for coming, and I am going to have to leave. But when I think of the questions you're asking, I think about how and why this place was built and why it seems to run so independently. I don't know anything about that other than I know it's different. And maybe this could be a way of looking, how can we do this, that this place runs independently? They actually pay their bills, have entertainment, and so on. This could be a way of finding a better way. And I think this place here is amazing. And I don't know how freely it runs of government. I know it's not totally free, but it operates, and unbelievable. And why can't there be more like this?
Yeah.
And maybe less government, but I don't know. I don't know how they put it together.
So,
But maybe the Department of Aging should find out.
yeah, so
Thank you.
this is a very unique building. I don't think I know of anywhere else in the Commonwealth that has this. The county got a grant 45 years ago because we're going to have a 45-year anniversary to build the structure here. But then they have the pricing and the way that we rent with the rent mixes. We mix it together that it is self-sustaining. So it pays for itself. The county doesn't really have to put funding into it other than the grant it got 45 years ago. And part of that is we make sure that we have great social activities. Now, the other thing is we fund the senior center down here. Not all activities are senior center, but the senior center that Ann is here and does during the day, that is funded separately by the Department of Aging through the Lehigh County Office of Aging.
I think part of the reason it runs so well is we have a great staff. I mean, they are pleasant. I mean, I've gone into some facilities that are, I mean, they've got their, you know, they think they have a crown on their head, and you're lowly people. They associate with us. They answer our questions, and they're helpful.
Good.
And amen. They are very. I mean, including the maintenance. I mean, those fellows are really great. I mean, you have a problem, and they're there.
Good.
Right
Good.
on. So I want to give them a hand.
Good. Perfect. It's great. Is there anything else that you guys can think of that we would like for social participation? Like it has on here, this might include religious activities, movies, concerts, plays, clubs, classes, other activities. We have 12 senior centers. This is one of them. That we have 12 in Lehigh County. Are there more activities that you guys like? Do you like bus trips? Do you like, what kind of things do you like to do that make you guys want to go out and get active in the community? Okay, that's a good point. Yeah, are there things that need to, because like we need funding to be able to do those kinds of things. We could do more of them, but there needs to be enough funding to be able to do that. Okay, anybody want to have any more comments on that one before we move on to the next one? Okay, let's move on to the next one then. Outdoor spaces. So this is basically like parks, places outside, different public spaces. How easy and accessible is it for people to go to the mall, to go shopping, to go anywhere in the community, to the doctor's office, any kind of thing like that? So any thoughts on this? Is our community set up to do this kind of stuff, to do these kind of activities? Yes.
Why can't we just have a van that'll take us to different things that we don't have to pay for, like Country Meadows, like Cedarbrook? Why can't we have that? Yeah, and Phoebe, we have all that. I mean, it would help us. It would give us more time and more activities for a lot of these people that are disabled. I mean, they need it and they can't drive.
So basically, we could get more transportation through like senior centers by having vans more available to seniors at more maybe the senior high rises, like the lower income ones. It's kind of like what you guys are saying, okay? 840 each way to go to the doctor is what she's saying with the van, with the Lanta van, right? Correct, okay. Any other thoughts about outdoor spaces? She's got one right here. Yep. Well, that's a building thing. That's a different thing. We can talk to you about that later.
I always joke around and say Citronia should really be down here on our property instead of up where they are.
Gotcha.
But I do want to say about the surroundings. Has anybody here seen, besides the people that live here, our pavilion out here? It's beautiful. We have indoor activities, outdoor activities. I don't see where you can have much more, really.
At this building, yeah. But is
This
it like this,
building.
is it like that everywhere? Though?
No, because I've worked in several of them.
Mm-hmm.
And I also know friends that live at other places from my church. And I'll say to them, we're having so-and-so tonight. Oh. And I think you have to keep them busy to keep their mind busy.
Gotcha. So we need to have more activities, is what she's saying, at other building high-rises, other places in the community for people to participate in.
Not here.
Yeah. Here we have it, but like other places don't have that. Honestly, they don't. All right, let's go ahead and move on to the next one then. Health services and community supports. This is a really important one. Medical needs can be met with a wide variety of health services and supports. These include services from healthcare professionals as well as long-term care services that allow a person with chronic conditions to live well at home. Our health and long-term care services available in your community. Our caregiver support programs available for people long-term with long-term care needs. What kind of things do we need to do with our health services and providing that? What about how affordable health insurance is? Yes, back there.
So before I get to the affordable health insurance, I think that everyone could use better access to affordable dental, vision, and hearing.
Yep.
Okay, and you may not be able to solve that, but at least including it in the plan.
Yep.
And I already addressed the safe, timely transportation piece to healthcare. Also, we have some concerns in our office, how the aging population is being marketed various Medicare supplemental plans. I think penny.com is excellent. That's an excellent one. But the independents who are marketing it, I don't think necessarily take into account the individualized person's needs. And we have patients who are changing constantly. They've been sold basically a bill of goods, and they take one insurance plan that not only is making them change their doctors, it's not covering much at all, if any, of their prescriptions. So I think somehow if we can, I don't know the answer, but include that in your plan.
Yeah, I think those are important things. Now, currently what we do have is we have Medicare counselors. It's a program called PA Medi. So what that is that's a program the area agencies on aging run where we're independent. We don't sell any programs, so it's independent volunteers that help people walk through when people are eligible for Medicare on to get supplemental insurances or on the yearly time when there's open enrollment to change that you can come to. They'll lay out all your options. The problem is there's probably like 100 options, so it's really difficult like for individuals, but that is a really, really nice program. Again, I don't know how well, if it's advertised enough, if people know about that enough, if people, because you can get set up through your area agency on aging to see a PA Medi volunteer to help you with those kind of things. Any other thoughts here? Kim, right here, green, in the green again.
I also want to say that unless you hear it by word of mouth, there's like help at the hospital. I know that years ago my parents were under the Hilberton thing at the hospital, and it was wonderful. I now belong to the, what are those initials, Rose? FAP, since my husband passed, because I couldn't afford to go to the hospital, because after he passed, he worked for the county for 25 years. And after he passed on a Friday. I called Monday and told them that he passed, and they said to me, well, Mrs. Coulter, you no longer have any health insurance.
Okay.
That hurt.
Yeah.
Yeah,
And that's a county. That was a county. That's a county.
that was the
thing.
county.
Yeah.
Uh-huh.
Gotcha.
I think the biggest concern when you're looking at things like this is older Pennsylvanians they don't know how to deal with the fraud. You know, they don't know who's a reputable representative. You know, we get phone calls, all the time. And how do you know who's good and who's not, and what you should and what you shouldn't? My mom calls me all the time. Hey, I heard this and I heard that. Mom, forget it. You know, but they just don't know.
It's a good point. There's all kinds of scams, fraud, stuff that's out there. It's very, very, it's very serious. We see lots of people that lose money all the time for all kinds of different scams and fraudulent things.
I just have a question. I remember seeing a brochure from the county that told you everywhere to go for help. Are those brochures still out in the community?
I'm pretty sure we do. Was it the rights and benefits booklets, or was it?
It would tell you who to go to for what help you needed.
Okay. I know we have
Are they
stuff
still out there? I mean, I haven't seen them.
Okay. But we can work on making sure that those are available more too.
Because I think that would be helpful to everybody, you
Yeah.
know, okay, I need a lawyer. Okay, it's in this book. Now I know where to go. I mean, you're
Gotcha.
telling us we have these things available, but now we need that book to also
Gotcha.
guide us along
Yeah.
the way.
And I know we have some agency brochures that have some of that stuff. We'll make sure we get those over to the building here more too, to
Okay,
pass
thank
out
you.
to people. Yep. Yep, we're updating them now. We're actually getting brand new ones printed as we speak. Right, Sue? Any other thoughts now on this one? Got one way in the back again.
Those brochures be sent to doctors' offices, because that's where the common people end up in crisis, in the doctor's office, and the doctor may suggest, have you thought about the aging, have you thought about the aging
So
agency?
you were saying to the put the brochures at the doctor's
At the
offices.
doctor's office, just having pamphlets on the aging that we can, because the doctor does not have the time
Yeah.
to hook us up, and they'll just say, briefly, we'll go to the aging agency.
I know we do send some out to doctor's offices. I don't know that we have like a blanketed campaign where we send them out consistently to all the doctor's offices. Any other thoughts? I like those though, because you're right. When people go to crisis, they might go to their doctor. Okay, let's move on to the next domain. Civic engagement and employment. So this is the last one, guys. So volunteering includes opportunities to engage meaningfully service in the community as a non-paid member of an organization. What kind of volunteering or work opportunities would you like to see or are missing in your community? What do you think communities can do to make volunteering or work opportunities more accessible to older people and people with disabilities? What are the main barriers older people and people with disabilities face in working on volunteering? What kind of things are out there for volunteering, for engagement in the community?
There's an agency in Bethlehem that I used to work for. It's called Senior Corps RSVP. And they always look for people 55 years of age and over who are willing to help in their community. The biggest need that they have right now is drivers, people that will take others to appointments. You don't do anything with wheelchairs, but anyone who is mobile, say with a walker or a cane, they take them to doctor appointments and pick them up from doctor appointments, but there's a waiting list because there aren't enough volunteers to help all those that need that help. And they do a lot of other things too. I volunteer with them and I do what we call friendly visits. There's a woman I go in and see once a week for about an hour and a half, and just to talk to her about what's going on in her life and her kids and things like that. But so there are a lot of volunteer opportunities out there. You just have to look for them.
Yeah, that's a great organization, RSVP. Kim's getting her steps for today.
There yet? Are you there yet? I do take people out and run errands for them. What is my personal liability if I get into an accident? Where am I covered?
That's a good question, and that's why sometimes I think when you go through some of the volunteer programs, they have that accidental coverage for you. If you go through their programs, they can cover insurances for you. But that's a great point. Yeah, if they get hurt or you have an accident or something happens. Yep. All right, anybody have any other things with employment, civic engagement, anything like that? So please be putting your comments down in your sheets. Is there any other things that we have not covered that aren't in the domains that anybody can think of? Back in the back we have. Yep.
My name is Barbara, and I'd like to just say that everybody here likes it here, including me. I'm here 13 years. I wouldn't want to be anywhere else. But for safety reasons, about 3 weeks ago, we only had one elevator working in our building. The one was broken down, and I don't know, the other one was always full. People move in and out, so they take those elevators. It was tough getting out of this building. So, and the outside where the patio is, those sidewalks are closed there. I don't know what it's gonna be like for winter, if that's even gonna be opened. So these are concerns for me, and I'm sure other people here. And even the hallways here are hot. And I've been told that the elevator, or where the recyclable is, they have fans there, but they're broken. So some nights, those hallways are really, really hot, and a lot of people like to walk up there, you know, on all the floors with their rollators and things, and it's too hot to walk. So these are safety issues I think should be looked at, if anything can be done.
Okay, thanks for your comments. All right, anything else as we're wrapping up, everybody? So please fill your comments out on the card. We want to collect them from you. Thank you for coming today. Somebody else? Yeah. If you don't have a chance and you want to like take some more time to fill them out, you can turn them into the office. We have the address. We'll send it into Harrisburg where they're going to go. If you don't live in the building, ask us as you're leaving. We can get you the Harrisburg address as well to send the information in. There are other ways also. If you want anybody else in the community or any of your family, friends to fill one of these out, we have extra ones here that we can give to you to send to them and tell them where to send it back. But thank you everybody for coming today. I think there's a little bit of food left over here, some more coffee, and there's a few more tablets over here. I promised some of my staff that these tablets are going to be gone up here, so please take the tablets. Thank you to everybody. Thank you to everybody today.